The thing that's unique about Atrium Health Behavioral Health is that we really have the entire continuum of services. Everything from inpatient care to all outpatient services. And it is our intention to design programs that treat the whole person and ensure that they have access to both physical health treatment and mental health treatment.
Our 24-hour emergency department is the only psychiatric emergency department of its kind in the state. It is staffed by about 25 board-certified psychiatrists.
One of the things that we knew we could expand access to is brain stimulation services for patients who experience depression, who have failed treatment with medication. And then they get access to electroconvulsive therapy or our transmagnetic cranial stimulation services. These treatments are safe and it's incredibly effective treatment. One of the other gaps that we identified early on was services for patients who experience depression, either while they're pregnant or after they've delivered their baby. There's also women who are addicted to either drugs or alcohol and then find themselves pregnant.
Partial hospitalization is a day program. Patients receive counseling, they receive medication services, as transitioning oftentimes from an inpatient facility back into their normal social environment can be very difficult.
When patients are diagnosed with severe mental illness, particularly illnesses that are a psychosis-related diagnosis, they often are first diagnosed in their late teens or early 20s. So what the First Episode Psychosis program does is get them into treatment quickly after that first break. We've worked hard at Atrium Health to expand the number of child and adolescent psychiatrists we have available.
On top of that, we have probably the most robust telepsych program, offering care to patients that otherwise really wouldn't receive any care at all.
If patients do come into our medical emergency departments and have a psychiatric crisis and need to be evaluated, our same group of psychiatrists and advanced clinical providers can see that patient virtually in 22 of our emergency departments.
Integrating behavioral health services into primary care practices, where the primary care provider remains at the center of care with a team of behavioral health specialists behind him or her to guide the treatment of that patient.
We have a very robust research program in which we're looking at Alzheimer's, and we do a lot of research with other departments, post-traumatic stress disorder and depression.
We've hired psychiatrists who are fellowship trained in addiction medicines, and they work to design effective treatment programs, whether that be medical detox, whether that be an intensive outpatient program, or just direct counseling. When you think about our mission statement, it speaks to hope, health, and healing. And when you think about people with mental illness and substance use disorders, those are often the things that they most need. They need to know that there's hope of recovery. In order to be in recovery, they need access to effective treatments. And so our job is to really educate the world that there is effective treatment and recovery is possible. And we want to make sure that all of our patients have that hope.